Do you ever feel a slight pinch in your shoulder as you raise it up like this? You're going to want to know about the supraspinatus. And one of my clients called it the supraspinatus to her doctor, but whatever. Let's show you. So, if we go close to Steve, you'll see a beautiful muscle right here. Whee! Going in under the shoulder and up into here. Well, guess what? So why would it hurt? Would it come up? Well, the supraspinatus job is, it's kind of like a part one to raising your shoulder up like this. Whoop, whoop. You have muscles on top of that that are the deltoids. Now they take over. As you come up like this, that's your supraspinatus. And then you go a little higher. Ooh, that's your deltoid. But a big problem with the supraspinatus, it's like you see in this AC joint, right there. When this shoulder goes, now remember his is dislocated, but in real life, this is coming up. And when it comes up like that, the muscle can go in and out, in and out. But why does it start hurting? Well, did you know a lot of people roll their shoulders forward? Comment below if that's you. Now, when this shoulder, which is supposed to be back here, goes up and down, that's nice. But when it gets slid forward, and then it tries to come up, it starts pinching on that bone. The nerves get mad. And when it comes up, tendon right here gets pinched. Ah! That hurts like crazy, and it will not get fixed on its own usually unless you do certain things, or get really lucky. But I'm going to show you some cool things. Another common reason for this muscle to start getting bad and pinched is if you have what's called T-Rex arms. And then, what does that even mean? Think of it like this. If you're an office worker who's doing work on the computer all day long like this, well, guess what? That shoulder is going forward. You're gonna start pinching on that, and it's gonna hurt. But guess what? There's exercises that you can do to prevent it. There's many exercises you can do, but here's a couple. Stand on the resistance band. Keep your shoulders back. Don't put your head forward. Keep your head back. Maybe even put it on a wall. And just do little mini comes ups. That's a word. Next, do this one. Coming up. You start feeling pain, stop. But if you go to the right where you feel it. What you don't do is this. Yeah. Keep it down. Shoulder down. Whoop, 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 whoop. Next, last one, we're going to do some infraspinatus. Come all the way out like that. But look at it. If your eyes see it, your brain will see it. If your brain sees it, it'll see that it's a safe movement. If it doesn't see it, problem is it's going to lock up in there because it's trying to protect it. We don't want that. We want to see it the whole time. Massage technique time. One simple thing you can do as a massage therapist, or maybe even not as a massage therapist, just try to do this at home on your partner, is you see where this is connecting right here? That's where the supraspinatus begins, goes under here and over to here. Well, what we're going to want to do is we're going to want to press into the knot, reduce the inflammation, allow the muscle to move freely, and calm the nerves down. So what I'm going to do is we're going to press on one of these. Right where you think of the triangle right here for the bones, we're going to press there. Now, as I mentioned earlier, if Steve will stop grabbing in his bands, when we press, we're going to have him do that activation that we had earlier. All you got to come up is about 30 degrees. And guess what? All this is moving. Shorten, lengthen, shorten, lengthen. So, if I press in there, come up, it will limit it. It'll probably be a little tender, but that's okay. Actually, when I press, it's going to press into the knot, reduce that blood flow, and allow the nerves to calm down. And next, I'll even show you, you can do is even same technique, but you're going to press your elbow right there. Just don't have your arm resting on their head. But come over here and press. Let me press here, your forearm, press in there, and have them raise their arm. These trigger points and these active release techniques are going to work really good, and they're going to help. One more. I'm going to show you something cool. I'm going to hit the insertion this time. It gets really tender. You'll see, connects here, right? So I'm going to try to get into there with my thumb, and now press and raise up a little bit. Just a little bit. Let me show you where he's going. Just a little bit of activation. Last, I'm going to show you another technique I like to do. So, remember what I said with his shoulder rolling forward, which is causing that pain. So what I want to do is I'm going to get his humerus a little bit down. I'm going to put my palm here. Okay, I lied. I'm going to do two more techniques. Press into there and push in. Push in. The other one, and I really like doing this one, is let's say his shoulders on the ground, or not on the ground, that would be very flexible, but I'm going to press into here and hold it down. I'm not going to let him pull his shoulder up here. He's going to be here. I'm going to hold it down. I'm going to put my hand on the back of his hand, and he's going to have to try to lose an arm wrestling match and go backwards as I push down into it. You could even maybe put a pillow right here to elevate it, which is going to help it a little bit more slide into where it needs to be. Pushing it down and in and push back. Do it the other way as well. You can push down and have them push you. You could also stand on this side, putting your palm into there and leaning in and have him push towards you. Those techniques are going to help. Between massage therapy, between the exercises I gave him, and maybe a couple other things I'm going to give, probably depending on the severity, because frozen shoulders, impingement, stuff like that, it's not always the supraspinatus, but just in case it is, we want to work this first, because you also got a lot of other things that what we're going to do now, and at least you know when you work this out if it's a supraspinatus or not. But let's see if Steve can move his arm again. Oh wow, that feels so much better. How'd you do it? Here, with your friends. I don't know why I'm talking like an elf. Thank you, Steve. That meant a lot. Well, y'all have a good day. Thanks for watching.